Hi, welcome to the Agent Odyssey. I'm Matt Wyman, CEO and co-founder of Acario. Acario provides a simulation platform, so you can test those voice, chat, and headless agents to make sure they do what they're supposed to before they go to production. Today, I'm very excited to have Josh Quintal with us. He is the CEO and co-founder of Optego. They are in the health tech space using AI to really dig into that doctor-patient relationship. And I'm excited to have Josh here to tell us more and so we can learn more about that space and what's possible. Josh, welcome.
Nice. Yeah. Hey, Matt. Thanks for having me. Happy to be here.
Maybe you can kind of tell us more about Optego. Like, what problem are you diving into? What's that big vision that you're tackling?
Yeah, for sure. So you gave a very good intro right there as well. I mean, that doctor-patient relationship is definitely where we're starting. But the issues that we're tackling more broadly are really communication across healthcare. So that includes both the patient-provider angle, or you could say patient-doctor, kind of where we're starting. But then there's also many different like intra-provider use cases, like anytime you transfer from, let's say, surgery back to your primary care provider, shared decision making between not only your care team, but then also a little bit of the patient angle there as well. There's a number of communication points throughout anyone's healthcare journey. We think we can benefit all of them with AI, but we are starting with the patient provider portion.
So tell me more about this, because as a patient, especially if you're having to go through anything that's more than just one conversation with the doctor, even if you go to get tests, you have multiple touch points. Where in that moment is Optego involved?
Yeah, so a lot of this it comes down to, and sorry, I will answer your question, but I'm realizing I should go back a little bit and dig more into the problem. So it's kind of two pronged when it comes to these communication issues, and I'll focus now on like provider patient. And part of it is that really just the communication model is kind of old and outdated. I mean, the way like going to the doctor at a hospital or a clinic, the way things get done, then you get sent home basically with some kind of treatment. You don't need to be too knowledgeable about it. That kind of loop has been, going on for ages, since like the turn of the century. Oh, which now I guess refers to 1900, 2000, but you know what I mean.
Which
I'm
one?
referring to early 1900s. Yeah, exactly. Jeez, by my age. But, and then the other prong of it too, what's kind of prevented improvement, because I know that probably sounds very obvious, like, oh, okay, well, why don't we just make better documents? Well, the problem is that a lot of those are made to fulfill either regulatory requirements or insurers, not what are called payers in the business as well. So there's just never been really any momentum behind restructuring a lot of those documents. I mean, the one that to get even more narrowly focused, one we're working on right now are discharge reports. And so when you're
Hmm.
discharged from the hospital, you get this document, usually called a discharge summary, that ideally should very easily or very succinctly go over what happened during your visit, any medication changes, any complications that happen during your stay in the hospital, things you need to do, things to watch out for, all this different information. That's in the ideal world. I mean, in reality, it often comes out very jargon filled. Maybe some things will
Yeah.
be in a nice list, like the obvious stuff, like maybe your medications are in a nice list. But then as far as things to watch out for or the actual whys or reasons behind the decisions that happened in your care are often just buried down in like a generic notes area that's at the end of the summary. And so that's like a place that Optego really shines, is really pulling the whys out of there to not give you just
Hmm.
what happened during your visit, but extracting really the important things you need to do next. So any actionable items, but then also connecting why certain things happen. So you can be more knowledgeable about your health to, A, recover faster, but B, to take care of yourself better going forward as well.
The need, I mean, I've recently had some experience with this, and as a patient, it is awfully difficult to figure out what exactly happened and understand what the next steps are. But I have to imagine there's also a trust component in here, because the doctor wants to make sure that that's communicated effectively to the patient. Probably they want to make sure that certain things are communicated or even held temporarily until they have a chance to communicate them verbally. How are you negotiating that? What should be said versus what shouldn't be said, and who approves it? How are you negotiating this sort of trust factor in that generation?
Mm-hmm. Yeah. So for us, we're able to sidestep a lot of that because the kind of the way we're starting is sort of our initial wedge. And the reason why we don't need to worry about things like FDA approval and things like that, and it's a good place to start, is that we actually just take the discharge summary that's already produced for you and essentially translate that for the patient.
Oh,
So any
interesting.
communication decisions with this very first product we're rolling out have already been made. And we're simply communicating those in a better way to the patient. And then, of course, also giving them ways to track things like follow-up items and all that stuff, which is better than a paper document. In the future, though, kind of to that point of the intra-provider communication or communication within a hospital, to be less fancy about it, that's where those decisions will have to get made. And that'll all depend on the workflow of the hospital. So at the end of the day, of the hospital or clinic, I should say, because independent providers as well. But um, that's kind of the challenge for any really healthcare startup. I mean, even AI or otherwise, is figuring out the workflow of the current organization and then just fitting into that naturally. A lot of times that means really like integrating with their like EHR or their technical systems. So in the case of like the question you just asked, like, is there information that they want held? My first kind of question back to that would be like, is that being marked in some way? Like how is the hold versus
Mm.
communicate decision being tracked in their system? And then we would simply follow that by integrating or maybe subscribing to an event, like whatever was necessary to make sure that the intention was upheld.
Do you have sort of this future vision where a patient, after getting one of these summary reports, is able to interactively ask questions about it and gain more information? Do you see that sort of as an integrated loop there? How do you see that playing out?
Yeah, I see that as the ideal future there, where there's sort of like a multi-tiered kind of like system of escalation. There's a better word I'm searching for, but not finding, where essentially like hopefully we've boiled down and extracted out key information you would want, and maybe you would feel the need to ask a question, but again, that's probably not going to happen. So that'd be like step one, hopefully we're just pulling out the right info. Kind of next step up, you should be able to communicate like with the AI that has knowledge about like your health record, your discharge summary. So that's another component of it as well, is that rather than just translating that discharge summary in isolation with the patient's consent, we can pull in the rest of their health record as well, which hopefully especially uncover, especially things for like follow-up items or like I mentioned, future health tips and things like that. That's really helpful for that. But I digress. So then, like, yeah, next step, you should be able to ask the LLM sort of like basic questions, right? That don't, I would imagine, regulatory and frankly, capabilities of LLMs at the time. The LLM should not make any diagnostic advice based on that. But if you're just looking for
Right.
facts, medical elaboration, like based on your current case, like the LLM should handle that. But then the third step is, yeah, there's like a natural escalation path there, where if you are asking like a diagnostic question or something that would trigger or necessitate like a test or something like that to determine, then that gets elevated to your doctor, which I know may sound burdensome. That was even like my initial thought, but a lot of patient portals kind of already give you just unfettered access to asking your doctor. So it's a little bit of our pitch as well from the provider side, other than like costs and things, which maybe we can go down that rabbit hole later, but is that actually this can save you from kind of these more mundane questions that maybe you don't have to answer now, because a lot of that ends up being pajama time for the doctor, which is time spent after hours doing paperwork or
Well,
answering
I mean,
questions.
they may be unfettered, but the response typically isn't incredibly fast because doctors typically are overloaded, right? They're seeing a lot of patients. They only have so much time. They have to do so. They need to respond, as you said, after hours or sort of in the edges, which also means the amount of focus is a question. I'm curious how you're handling well, I would be worried about oversimplification. That would be a concern I would have. And I'm curious how are you tackling that if you're trying to make it more consumable, which requires some amount of simplification? How do you balance that?
Yeah, the ideal that we're aiming for right now is an eighth grade reading level. And the way that we kind of handle that, which yeah, can get pretty simple. You'd be surprised. It's actually a relatively good threshold of complexity. I think personally it probably goes beyond that sometimes just out of necessity. But yeah, there definitely shouldn't be any like Latin, hopefully it's unnecessary or any kind of medical jargon like that. But as far as oversimplification, that's where working with all of our clinician partners comes into play, having them check the outputs and just continually running tests and evaluations on that output. So we do have one doctor actually on our team, and then we have a number of other doctors who are advisors for us as well. And so they really help us check the integrity of that output.
I mean, it all fits together. And you mentioned this earlier. This initial wedge has to be high enough value for patient and physician or provider that they want to take the time to use it and consume it and lean into it. But it has to be low enough on the risk scale that you're not suddenly exposed to all the possible, which are probably good things in the long run. In the long run, there are all sorts of maybe features and capabilities you'll want to add that will require approval from larger agencies and whatnot and regulation. But as a startup, you got to find that wedge, that way in. How did you figure out, and how are you ensuring that you stay in that sort of zone that allows you to explore and to learn and to play with things like what grade level do we want to use in our descriptions? How are you balancing that as you think about it as a business?
Yeah, so a couple different things there. I mean, one is following best practices where they're possible. Like even the eighth grade reading level, I don't remember the exact source, but it's either the AMA or the NIH. It was definitely a recommendation from like an authoritative medical body to go with that reading level. So that's definitely one portion of it. As far as any like legal hurdles, that's actually the great reason my co-founder is she's a lawyer. Very
Ah,
helpful there, keeping us within the
listen,
regulatory boundaries that are necessary.
are you finding that challenging? I mean, is it challenging to kind of navigate your way through that as part of health tech? I mean, a lot of folks are a little nervous about health tech in general.
Yeah, it's challenging, not in the sense that I'm actually worried about causing any harm or anything like that. It's more that it's it can be kind of frustrating because sometimes regulation will box you in from doing something that you'd like to do. It's like I've been a product guy for many years, so like I'm always like dreaming and thinking of like what can we do, even talking to customers and they'll have some problem, and I it sucks when the reason or the answer I get to give is like, oh well, we could solve that, but actually there's this regulatory hurdle, because then I know that that means, at least if it's like just a current regulatory issue, something we need approval for, then that'll at least will happen eventually. But sometimes, issues will come up where just the regulation is not favorable to it happening at all.
From what you've seen so far, I mean, you're tackling, in some ways, you're making our medical experience more consumable, more personal, right? So that I actually understand what's happening. I can have that relationship. I had a relationship with that as my sort of presumed North Star. How do you see AI in general in health tech and the regulations that people are talking about? Like how's the community looking in terms of the future and how it's being regulated, and what are you concerned about in that space?
Yeah, I mean, currently regulation's kind of a mixed bag currently. I mean, one thing that's on the good side for sure is that there's a lot of focus on it. I think there's a lot of people I've talked to, even on the government side of things, not just other providers, but who recognize like the potential value here and don't want to string it up, right? Don't want to repeat, kind of current issues with the medical system where like certain, like obviously there's this trade-off where we want this abundance of caution. We're dealing with people's lives. But at the same time, I think we can all think of some instance where like a certain innovative treatment or process or something kind of gets held back
Mhm.
um, due to, yeah, kind of the sometimes excessive regulatory scrutiny that's needed. Part of that's because like there's actual good regulation aimed at harm reduction, and there's a plenty of lobbyist regulation in there that's like written in to either benefit incumbents or kind of slow things down on purpose. But no, either way, I do see, yeah, great, at least in initiative verbally from the government to work on these things. And I've seen good things as far as like interoperability finally getting pushed, price transparency finally getting pushed. A lot of these things that have sort of been soft regulated, but now like the industry is, I think, kind of getting a kick in the pants from AI to kind of move on this. So
Which is
that's good.
good.
Yeah. And then on the provider side,
I
it's
mean,
kind of a, sorry, go on.
no. I was actually going to ask almost literally that question. Keep going.
Nice. Yeah, yeah. So yeah, on the provider side, it's kind of a mixed bag too. I think overall there's excitement for AI and the surrounding technologies. The trepidation so far is, I think, something that's kind of existed for a while in digital health, which is a tech company coming in that understands the tech they're implementing, but doesn't understand like the healthcare. Like again, this workflow word comes up again, doesn't understand the healthcare workflow, doesn't understand how it actually works, and just kind of starts proposing a solution, that sort of the provider really knows isn't going to work. And so it's just a waste of everyone's time. But there's actually a phrase, I don't remember where this quote comes from, but I've loved this. It guides a lot of my thinking in business. But it's if your idea relies on relies on the phrase, if people just blank, then it will work. But it's like no one's just gonna do anything in order to use your product. And it's like I feel like founders in digital health have to think of that. It's like, oh, the doctor would just click one more button or just open one more browser tab. Like, no, no, it's not gonna happen. Like, you definitely have to take the time to yeah, understand how it's going to work. But again, overall, a lot of enthusiasm there. Especially, I know I was recently in an event where there was a panel discussion with the new president and CEO of the AMA, and he,
Hmm.
yeah, it was a very good panel, and it was very clear that he like gets it as far as and actually with like greater integration of technology. I mean, he was talking about how even like wearable data, outside of AI, wearable data, we've got all these other tools, and he can't integrate that into the health record right now. And so there's
Right.
even work to do there. But yeah, but overall, I
By
think
the way,
I think the future is bright. There's a lot of enthusiasm across the board.
I think so too. It's funny you mentioned the word just. Actually, for me, for years now, going back to when I was an engineer, I learned the hard way that anytime I hear anyone say just for any reason, it's almost certainly A, not true, and B, very questionable. Nothing is
Yeah.
just. Doesn't matter what it is. It's just not just. Just this, just that. Yeah. It's just a matter of doing something. It's easy. It's just you add X, Y, Z. Uh, the reason I asked about the regulation coming around that in terms of the patient provider relationship and making sure it's comprehensible is that one hugely broken, definitely needs to be fixed. So thank you for going after that. But it's never clear where the edges are from the outside. And so as an outsider to health tech and looking at people implementing AI, there's always that question like, wow, which things are going to get tripped? So it's wonderful to hear that this is a path that you can go charging down and helping people with. And the simplification is interesting. Like that concept of finding that right level, like the eighth grade reading level, which I mean, there's some words are just the names of things are the names of things that may not be easy to consume, but it is what it is. They can just be explained. Finding that right level of conversation probably is also very helpful to the physician and to the provider because they're accustomed to thinking in a particular jargon. In fact, you want them to be in that headspace. You want that
Mhm.
universal translator to the patient on the other side. Making sure that you don't miss something in between is an interesting use of AI. I wonder if you can also describe the sort of living organism of we humans change over time. As we go back for another session, that might shift a prior understanding or interpretation of what happened. How do you see that fitting together and how do you help the doctor communicate those kinds of changes?
Yeah, definitely. One thing you jogged my memory on something I should have said actually about the oversimplification point, and then I will definitely address the living organism and changes in health data. So on the communication side, we don't just do well. We do like the initial pass that like gives you your simplified record, right? The human readable version like of your discharge summary, let's
Hmm.
say in this example. But throughout it, we kind of highlight different entities like in the record. So any diagnostic points, any medications, any appointments you have to make, and you can actually click on those, and then we'll surface more information about the particular thing that you clicked on. So, like in our demo example, if you go to our website or if you've seen it on social media, someone's discharge summary for and they got pneumonia in the hospital. You can click pneumonia, and it will actually like expand a new card that shows data like about like person specific pneumonia case. It was in their like lower right lobe, which is like the bottom part of their right lung in this case. So it'll give you like an overview of that. In this case, we had some vitals that changed in the hospital stay, and so we were able to make like a graphic for that. And so yeah, we kind of give you opportunities to like dig deeper if you want of your own accord. And so then that's nice as well, because then we can get a feel for like each individual user's kind of appetite for how deep they want to go as far as the research. And then that helps us also like with future summarizations as well.
Yeah, it helps them understand because that's the relationship actually that everybody wants. They want that relationship so that the next communication is just that much better and is that much more contextual. Are you trying to stitch it together so that there is this sort of longer term view that you can reference back? Do you have to keep it narrow to each event? Well, what are you hearing from patients on that front?
Yeah. So from our angle, we think that, I mean, your whole health record is important. And to the point of it's kind of dovetails back into the living organism aspect is that like you do need that history in order to know what's changed, right? So we don't just take in like the discharge summary or the whatever like acute document that you got as part of that episode of care, but we consider the entire history. And then to your point about the living organism, that's why generally we try to subscribe to the EHR or we're listening for events like that change in the patient's record. So there needs to be an update on that side. we're able to make it. But then also, you may have been referring to this too, but also like medical knowledge, right, is changing over time. This
Hmm.
seems pretty difficult to calculate, but I saw that like the amount of medical knowledge is doubling now. Like that doubling time has been going down, down, down to the point that now every 52 days, according to this paper, the amount of medical knowledge is doubling, which is insane. Yeah, so that's another whole part of it as well.
That
Is
makes me wonder what knowledge is. Is it just more data points?
Yeah, really. Well, I know part of it from like a previous iteration of our business. We were focused on lab tests, and I know that I mean, there's hundreds of new lab tests every year.
Yeah.
And that's not even including in genetic tests. There's even more. I mean, that's just diagnostic lab tests I'm referring to. For
And we're
genetic tests,
learning the
there's yeah,
interrelationships. Absolutely. Absolutely.
yes, there's a lot to explore there.
There's a lot to explore and there's a lot of opportunity. I mean, you're tackling a very specific area. As you look more broadly across that health experience, if you will, are there other areas that you're really not necessarily that you're going to tackle, but you're eager to see tackled? They're going to just sort of create a better overall environment that then you can make more personal and help communicate. Like you
Oh, it's
mentioned
interesting.
wearables, you mentioned other data fitting into the EMR. What else are you seeing?
Yeah, that's definitely something we'd love to integrate. We're thinking through how that can work. Because of course, like all the wearables have, yeah, I should state out loud. So referring to wearables and other like personal health monitoring items that you can buy. And the difficult part won't be technical integration, right? That's like they all have APIs. Like we could pull in your watch data tomorrow if we wanted to, probably. But the issue is, and this is something we'll probably have to work with both providers and regulators on, is like, yeah, how do we kind of update the very concept of the health record, right? To actually integrate that data with it as well. And so that's kind of so that's an angle where I think we can assist in that hopefully. But then more broadly, just getting more data, more types of scans, more inputs. I'm excited that lab tests, for example, are becoming more accessible. It's getting easier and easier to initiate your own lab tests. I mean, I think there's even a number of startups that will just do
Yep.
consistent lab testing for you as well. I think things like that are important. Yeah, being able to actually like measure the body, things like that. I mean, one rabbit hole I went down like long before this. We didn't explore it as a business because it was too far out. But it's always interested me is the concept of a digital twin, right? And
Mm.
how do you make a digital twin of something as complex as a human body? Right? And so I think there's a lot of interesting work there. But that's also I say that because that's also what's kind of driving some of this greater number of scans and ways to get input data into the
Yep.
system to sort of make those reliable simulations. Because that'd
And
be like
label
the
label
ultimate.
data so you can actually communicate.
Yes, yeah, exactly. I mean, that'd be the ultimate. My like, ultimate crazy person dream for like digital health is something I call the next moment physiology predictor, right? Like instead of predicting the next token, there should be a model that's got all of my medical data, like use even humanity's medical data to extrapolate and then you know, kind of be like precog, like you've seen Minority Report, like, predict things that will happen about my body, like before they actually happen.
Yeah. Yeah. In aggregate, I mean, it feels rational that in aggregate, maybe it may not be 90+% accurate, but you might be able to get down to, a narrow range where you can be aware of potential trends and likelihoods based on all sorts of factors that are all traceable. I mean, I'm wearing a watch that tracks me all the time. Like there's a ton of data, and it's actually, I find it unfortunate that I can't share this data easily to my providers and have them look at it and give me feedback. I mean, I'm looking at it all the time and I see stuff, but why aren't we connecting the dots? And it's amazing, but we'll see this start to come together. I have high hopes for startups like Optego in terms of bringing AI into that relationship and into that space where we can actually start to connect the dots a little more, stitch it together. I think everyone's overworked and they're looking at everything through a periscope. And I think these language models and models in general and these new and startups like yours are giving us a chance to broaden that look at the patient, at trends, and direction. And we're running out of time, but I want to make sure to ask. And to me, this is a critical question I ask everybody. I'm really interested in the human side of everything. Like how do the changes we see in the world affect us? What do we need to do differently to be engaged and ready for all those changes? And so in this case, I'm curious, what are the skills and what are the things we need to work on as people to be really ready for AI in health?
Ooh. That's a really good question. I mean, part of this one's probably a little bit pie in the sky. Maybe this is something every tech guy would say about any new technology. But I mean, I think it would start with definitely becoming more versed in AI, and that even includes. I'm not saying everyone has to, this isn't like a learn to code pitch. Everyone doesn't have to like go out and crack open like building an LLM from scratch or whatever. But even just poking and prodding it, seeing what the limits are, kind of getting used to interacting with it. Because then you kind of discover you get an intuition for sort of like things that it's good at and things that it's not good at, or maybe various ways to communicate. Because the way that you prompt, right, does affect the output. I mean, I've definitely seen friends of mine who will like complain about like this isn't really working for me. This output's not usually reliable. And then I'll come in and it's like, oh no, because like you're giving it one sentence of context. Here's this like longer prompt I use that's very sectioned out, things like that. I mean, now that said, of course, hopefully we abstract a lot of that away for the end user like with Optego, but there's still something to be said for getting a feel for it. But then the other
and removing
portion,
removing the fear, right? I agree with
yeah,
you that sort of that fear of new, the fear of technology, the fear of what's new. There are a lot of folks out there who are, because it sells, sells ads or whatever. They're beating that drum of fear, trying to get everyone all riled up. But at the end of the day, if you embrace what's coming, and a good example, like you said, is if you're prompting, if you think about like what do I want to get back? What kind of context do I need to put in? You'll get something richer back if you put something richer in. And this is kind of a common sense at some level. And if you're resisting, then you won't think that through. You'll always be, pushing it back just a little bit. So it resonates a lot with me that, and I agree, maybe it's because we're technologists, but it does seem like you got to be ready to embrace the change and see what's possible and look for it.
Yeah, for sure.
Well, Josh, thank you for a great conversation today. I appreciate your coming on here and talking about Optego and all the things that you're building.
Nice. Thanks for having me on, man. It was fun.
Absolutely.